very common to tear an ACL during a non-contact sport, such as soccer, when you're making a sharp turn, or if you're rounding second base and you turn the wrong way. These are usually stop and go kind of awkward movements when you're moving fast and you make an awkward movement to try to stop. Usually that results in an anterior cruciate ligament tear, ACL tear. For the most part, if an anterior cruciate ligament, someone suffers an ACL tear, it creates instability. When it first occurs, people usually develop very sudden swelling. Sometimes you may feel a pop. Long term, there is instability where the knee starts shifting because you don't have that same stability ligament keeping it still. So the knee usually shifts forward. As a result, this movement grinds through the meniscus and often results in a tear of the meniscus. When the meniscus tears, that portion of the meniscus essentially dies because the blood flow becomes limited and you lose a level of protection for the articular cartilage. That results in the articular cartilage flaking off, bare bones start showing, and that is arthritis. So the goal when someone has an anterior cruciate ligament tear or an ACL tear is to stabilize the knee to prevent further tearing of the meniscus and prevent premature arthritis development. So that procedure has been developed many decades ago and has really become the gold standard of ACL reconstruction and fixing ACL tears. In time, other grafts have been used. Some people use the quadriceps tendon above. Some people use a hamstring, a portion of the ligaments over here. My personal preference is the patellar tendon here because we use a portion of bone above, portion of bone below, and we fix it bone to bone. There it has a greater, stronger fixation. More recently, in the last couple of years, an ACL repair has been reevaluated and optimized. And what more recently things are being used for ACL repairs, not the reconstruction, but actually repair the ligament back onto the bone, is using a scaffold. So there are actual structural sutures that are used to repair the ligament, and the sutures themselves are so thick and strong that they're used as a scaffold, just like you would have a scaffold in a building. So to allow a secure place for that ligament to heal back onto the bone. And it's become relatively popular. The only thing is that it's not for everyone. Ideally, it is only used or should be used for what's called an avulsion right at the bone, right where the bone comes off. So I'm going to use a pen instead of my big finger. So that ligament can tear off of the bone or avulse off the bone or even take a piece of bone with it. That's the ideal candidate for someone to have an ACL repair because usually the tissue is nice and thick and healthy and big and can be put back on, and the likelihood of healing is much higher. If the tear occurs through the mid-substance, it's not a good candidate for an ACL repair because there's not enough tissue and we have to pull that tissue all the way up here. If the tear is off of the bone here, again, not enough tissue to be brought up there. Some ACL injuries occur when the bone itself cracks over here. That has always been fixed with an actual repair back onto the bone. But here we're talking about a repair where it's above the bone and it's in the mid-substance or in the actual tissue itself, which is the vast majority of ACL tears. Those have been attempted to be repaired again. Ideally, it has to be someone with an avulsion, a rip off of the bone above, but even in that case, if you are a high-level athlete, or if you're a professional athlete, or if you have very high demands, really it's probably not the ideal procedure for you. Personally, I would stick with the gold standard, using a reconstructive procedure where we take the tissue from here, and then ideally the bone patella tendon bone, and implant that. Because that has had decades and decades of shown great success. Right now, it seems a little bit of a risk to proceed if you're a high-level athlete or high-demand person to proceed with just a repair, even if it is an avulsion right above at the attachment.